So Dr. St-Pierre is hematology oncology. So first question I have for you is, could you give everyone sort of an overview of hematology and oncology, and then where do you see patients and where do we offer this service?
Hematology and oncology, we see everything relating to blood diseases, blood disorders, bone marrow diseases, and cancers. So there's really not a lot within that realm that we don't see. We're able to do a lot here, actually. And so we'll see benign disorders like anemia, platelet disorders, clotting or bleeding issues. And then we see all different types of cancers, so solid tumors, blood cancers, lymphomas, leukemias. Like I said, there's really not a lot that we can't do here in terms of, our expertise and when it's the right time to come to us. Honestly, I feel like the best thing to do if you're not sure is just to reach out to myself or Dr. Alameddine, and we're always really happy to review cases and see if it's appropriate for our services.
So some of the cancer is treated by chemotherapy. Some of the cancers would be treated by other methods, but that's also available in your same clinic area, correct?
Yes, so we have all the FDA approved treatments, or I shouldn't say all of them, but pretty much all of them in terms of chemotherapy, immunotherapy, and targeted treatments. And Dr. Alameddine and we stay up to date with the novel therapies, with cutting edge treatments, and basically we're able to offer the highest standard of care.
So if somebody's in like a treatment, like a study or a protocol or something, they may have to go somewhere else for that. But say even if they got a treatment plan, could they bring that back and have you help them with their treatment plan?
I would say one of the only things we can't do here is clinical trials, mainly because we don't have the infrastructure for that. If patients are interested in doing a clinical trial, then we will usually refer them to a more academic center, and then they will have to get their treatments where the clinical trial is run. If they go to another center and have an FDA-approved treatment offered to them, we are almost always able to offer them the same treatment here.
The majority of treatments that are kind of by protocol, in other words, once the diagnosis is known, there's a treatment protocol, and you can pretty much give those the same as they would anywhere else.
Absolutely. We have the same drugs, the same standards of care, and we have a phenomenal team of nurses and pharmacists.
Tell me, why would a patient then want to come specifically and see you or Dr. Alameddine here when they could go somewhere else? What's special about you?
At Great River, we offer the highest standard of care. We are able to offer, almost all the FDA-approved therapies, like I mentioned before, and Dr. Alameddine and I really try to stay up to date with all the novel therapies. We also have a very personalized touch, and we have that small town feel to our clinic. So I think that's what makes us special. We really get to know patients on a deeper level, not just from their disease, but for who they are and their families, and we really get to know them as people and not just as patients.